A lowdown on post-exposure prophylaxis, what you need to know. If you've just had a possible exposure to HIV, there is something you can do to help protect yourself from HIV infection. It's called post-exposure prophylaxis or PEP. That is a 28-day course of antiretroviral drugs that can reduce your risk of getting HIV if started within 72 hours after a possible exposure. PEP is not 100% effective, but it can greatly reduce your risk of becoming infected if taken as prescribed. What is post-exposure prophylaxis? Post-exposure prophylaxis is a medicine regimen that may be used after you have possibly been exposed to HIV through sex, an infected needle, or any other potential source. It is a prevention strategy that can reduce your chances of becoming infected with HIV if started within 72 hours of exposure. Who should get PEP? If you think you may have been exposed to HIV, it's important to seek medical help as soon as possible. This is what's known as post-exposure prophylaxis or PEP. PEP is available to anyone who has been exposed to HIV, whether through sex, sharing needles, or another exposure. It's also important to remember that PEP does not always prevent HIV infection, but it does increase your chance of not becoming infected if started early. What does PEP involve? PEP is a 4-week course of HIV drugs that can prevent infection if taken within 72 hours of exposure to the virus. PEP drugs work by suppressing the virus and preventing it from multiplying, which reduces the chances of infection. The course usually consists of 2 or 3 drugs, which are taken once or twice a day as prescribed by your doctor. The most common side effects of PEP are nausea, vomiting, diarrhea, and headaches. However, these side effects are usually mild and tend to disappear after a few days. How long does PEP last? One of the most important questions you might have about PEP is how long it lasts. The answer is that it depends on the type of exposure you had and the type of medication prescribed. For example, if you come into contact with HIV, PEP may last up to 28 days. It's important to note that PEP is not a cure for HIV. It's meant to reduce your risk of HIV infection after potential exposure. Are there any side effects? You might be wondering if there are any side effects associated with taking PEP. The truth is that while most people don't experience any side effects, some may have mild reactions like nausea or headaches. You should also be aware that PEP can interact with other medications you may be taking, so it's important to talk to your doctor if you're already on any other drugs. How effective is PEP? The effectiveness of PEP depends on a few factors, such as how quickly you take it and the type of exposure you had. If taken within 72 hours of an exposure, PEP is most effective when it comes to preventing HIV infection. However, it's not 100% effective and doesn't guarantee that you won't become infected with HIV. Other factors that can affect the effectiveness of PEP include the amount of virus the person has been exposed to and the strength of their immune system. Taking PEP does not mean that you should stop using other prevention measures, such as using condoms or taking pre-exposure prophylaxis. You should contact a doctor or clinic to discuss whether PEP is right for you if you think you have been exposed to HIV. For more such informative videos, like and subscribe to our channel MEDWIKI.